Good morning, everyone, and welcome to this edition of Macro Pro and Friends. We're excited to be with you here today. I'm Diane Cohen, and I'm the Vice President Client Relations, and I head up the Educational Department for Macro Pro. Macro Pro is a document retrieval company. We can get records for your litigated and your claims files. Regardless of where those records are, nationwide, worldwide, Macro Pro, we can get them. So be sure to call on us when you need records. Today, I am joined by Felicia Amanta, the Senior Manager for Workers' Compensation Programs for San Diego and the Imperial County Schools JPA. How are you, Felicia?
I'm doing great. It's my pleasure to be here. Thank you, Diane.
Well, we're glad to have you here. So I understand that your school district is doing an amazing job feeding people during COVID. Can you tell us a little bit about that?
Sure. Obviously, our mission is educating children, but also a big part of our mission is feeding children who sometimes only eat when they're at school. So once COVID hit and our schools shut down on March 16th, our school districts across San Diego County served more than 6 million meals to the families in the communities, which I'm very impressed, and they're my heroes, our food service workers.
Oh, absolutely. I really wanted to spotlight that today because that is such an amazing thing that they are doing. So we are really looking forward to today's program on lessons learned by COVID, but I do have a little bit of housekeeping before we get started. So your certificates are going to arrive to you in approximately 2 hours by GoToWebinar. It's very important that you have logged on to the GoToWebinar platform because that is how they track your hours in attendance. If you just phone in, they can't track that. So make sure that you log on so you can receive your certificate, and they will send that to the email that you used when you registered. All right, so we have handouts for you today, so make sure that you download them. They're on the control console for you, as well as if you have questions, you can ask our experts questions by just typing them in, and at the end of the program, Dr. Deborah and I will be reading those questions and getting some answers for you if there is time. And then lastly, there'll be an encore presentation of this on the Macro Pro website. So I hope that you guys will join us there for that. Now, Felicia, can you go ahead and introduce who your co-panelists are?
Yes, it's my pleasure. I want to introduce the moderator of our panel, who's going to introduce the rest of us, Dr. Deborah Depree from Relationships at Work. She's worked with employees with disabilities for 40 years, and she's worked with the ADA since its inception, and how she's very passionate about how to apply the ADA with the work comp system in California, and passionate about training and knowledge to teach us all how to deal with this complicated system. Right, Deborah?
Absolutely, because it is complex, and there's always a lot to uncover and unlearn. So thank you so much for that introduction, Felicia. And one of the things I love about working with Felicia and Rob as my co-presenters today is that they too are passionate about what they do. Felicia and I share 40 years of experience. It's hard to say that, isn't it, Felicia?
I started when I was 3.
Yes, there we go. I like that. And so 40 years of experience in managing claims and in risk management. And she's been in her current position as senior manager, as Diane mentioned, for the last 13 years. And, you know, one of the things I so enjoy about Felicia is not only her passion, but she absolutely loves her job. And so I think that's incredible. And she made the comment before we started that even during COVID, she loves her job. So that's pretty inspiring. And I know that we will learn a lot from you today, Felicia. And so with us is Rob Lower, and Rob is with Athens Administration, and he has 12 years of workers' compensation experience, you know, examining claims of all sorts. And he's got a story he'll share with us as far as how COVID has actually enhanced opportunity for him because he's now a supervisor, and what he really loves about being a supervisor is being able to impart his passion towards helping injured employees to the people he supervises. And so he brings a great deal of knowledge and experience working with school districts as Felicia, but also working with various private entities who are self-insured and public entities such as cities. And I would say most importantly, but significantly, he has a lot of experience over this last year working with in the healthcare and nursing home settings. And so lots to share with us. And so with that, we were going to move on here and to talk about where are we going today. And so again, lessons learned. Today we'll share some key insights, tips, and techniques for you. And so again, a little bit about our background. And we've got three key things that we're going to be sharing with you. What are some of the facts? Going back, this is dating me, I know, but just the facts, ma'am. So we are going to present some facts and figures that have shaped our last year and how that's differed from prior years and what that might mean for the future. Our second key point is talking about the impact on return to work practices. If we thought things were complex before and difficult to understand about the ADA, we certainly have increased that complexity with all of our new COVID guidelines and requirements. And then let's take a look at the long haul, the long-term effects of what's been happening. And so we'll have a chance to explore and uncover and discuss how all of those three things come together. And so one of the things that we're going to do, as I've mentioned then, is I love what Rob had to share with us as we were preparing for this program, is that really being at the ground level and in the trenches. And he'll share how particularly people at Athens, really came together, shifted their practices, and pivoted quickly. And so he will be emphasizing more of the healthcare, nursing home, and self-insured large entities. And then together, both of them will talk about their experience with public entities such as school districts and cities. And so I hope you're listening because there's lots to learn. And so Rob, one of the things that we have talked about is, I'd like you to elaborate a little bit on just what did Athens go through in making this rapid shift into our COVID era?
Okay. So I like, as you can see from the chart here, we have month to month sort of the COVID numbers. So you can kind of see how things developed, and even when we thought it was at its peak, it wasn't quite there yet. But initially back in March, we had to develop a plan due to the stay-at-home order and the presumptions based on the governor's emergency presumption orders. We had to think of a plan of how to handle all these cases that were coming in. Now, in a common flu-like environment, we don't have to worry about, how things are spread, where they're coming from, contact tracing, anything like that, because that doesn't usually come into, that usually never comes into the workers' compensation realm unless it's a very rare situation where, maybe a flu vaccine or something in a hospital setting where you're mandated to get it. But otherwise, it's excluded from the workers' compensation. So we had to learn quickly how to adapt our processes and look at COVID-19, and then we had to educate everybody on how to, like symptoms, treatments, what to do, employers, hospitals, public entities. The schools were shutting down at that point, so luckily there was some reprieve in that manner. But with the presumption laws, we weren't really expecting this to be, COVID-19 was expected to be an employer issue, right? Based on our current workers' compensation laws. But sure enough, and in hindsight, we really understand that, having people in close proximity to each other is how it spread. So it's not surprising that employers had some sort of liability placed on them for staying, for either having to, congregate people together or, not being able to separate or space out their employees. So we move from governor's order. Now that expires, and then we have this gap before the legislature or the legislative order in September comes about. So, and says, hey, here's another curveball for you. We're going to make everything retroactive. Hey, that sounds like fun, right? So yes, so that was a scramble again, but we had, and just during this time in June, July, you can start seeing the numbers going up, and then you think they're coming down, and they're not. Like they are just getting ready for the next big explosion. And that's when we get that new law. We're looking backwards at hundreds and hundreds of claims. And we have 122 examiners, unique examiners working on different COVID claims, COVID cases, files, employers. Yeah, it was a quite a thrilling, I will say, maybe time. And then during that time, we had a supervisor who went out on maternity leave. I think she planned this, right? Because that's when I took over that team. And in July, you see the highest numbers of COVID. It's not my fault. It was clearly just bad timing on my part to take over a team with, a hospital on it that's, near near an epidemic and near a pandemic, near a explosion of population of COVID cases. And so, yeah, and then healthcare settings like congregate living settings, residential homes for elderly, nursing homes, skilled nursing homes, all this. And then that's across the state as well. So I'm seeing just case after case. And I think being able to pivot in such a way was really a strength of our company. The people inside, all the employees were all volunteering, jumping at the chance to help out. So we were lucky the schools weren't open, because then we would have so many more people needed and then we still had regular claims. Like, people were still getting injured, right? I mean, this wasn't just COVID. Yeah, and then and then the CDC, right, in July, like to change. It seemed like daily they like to change their rules. Quarantine for 14 days, quarantine for 10 days. You're able to come back to work if it's 10 plus 3. Then they throw out complicated formulas. It seemed like, and they're just telling you, just bring them back, but bring them back safely. And I think a lot of our employers heard the message, and we're doing that the correct way. And then, the CDC also had, before all this, you needed two negative tests before you could come back to work. And that's why they started changing their rules about when quarantine was over and when they were safe to return to work. And yeah, it was a fun time, Dr. Depree. Yeah.
Well, it certainly sounds like lots of uncertainty and a lot of unpredictability, which certainly create a lot of instability.
Right. Yeah. But we met. I mean, we were able to talk to a lot of people, get a lot of different stories about how COVID affected their lives, their futures. So we're still dealing with some of the ramifications of that. And if you look at the next slide here with the, we can see the closing rates. They were, pretty much, we have, let's say we have, it was about 7,200 claims come through. 92.5 of those, 92.5% of those are already closed. So, which is great. We have a few open ones, but then just a larger picture of this is, the 122 examiners we had. Athens pulled together, everybody and anybody volunteered. We had medical only examiners, we had future medical care examiners, we had auditors who hadn't been examiners in years. They jumped on desks. I had to supervise some of those people. They were excellent. So, but then we also had, overall, we had 25 deaths on our claims, and you can see the age range. 35 to 75 years of age, and 7 of those are closed. And then we have 155 hospitalizations during this time period, and this is as of April 12th is when I took the data. So you have, and those age ranges for the hospitalized is 25 to 72. So nobody was spared. There was nobody who could just say, hey, COVID didn't or wouldn't affect my age group. You just couldn't say that in this time period. And then we have some of the, for you people who like numbers, the average cost of a claim is about 61,000, 62,000 if you round up there. And then you have average cost per claim is $3,917, so about $4,000. So in the grand scheme of things, if we were reflecting back, 4,000 a claim, that wasn't the hard part.
Okay, so Rob, I'm curious, given that you sort of cover three, separate industries, so to speak. You've got the healthcare, you've got some self-insured large employers, and then cities. Any particular trends in each of those that stand out for you as far as how they may differ or how they were similar?
So, I expected, police and fire, I actually expected a lot more to come out of police and fire than I actually saw. The cases that I did see usually involved office staff or police who got it from somebody, a partner in their own car, right? You didn't see a lot of public spread to the police unless they had no idea where it was, right? So it was just, I think we were getting more somebody spit in my face and I have to go get, tested for a while, like needle pricks in hospitals. Police and fire get that where they're exposed to splatter. So I think we got more of that than we did some of the COVID, or more often. So which was good because, we didn't want to see a lot of that. And then schools, because they were shut down, we saw very limited there. But hospitals, they were just every day. There's really no way to even utilize the presumption denials, right? So you'd have groups of the population who could be denied by the presumption, but because the hospitals were so inundated with patients that are coming through, they'd talk to the front staff, they'd get, walk through the building, you'd walk by, office staff, or we had a lot of just exposure. And so a lot of those hospitals just, everybody was potentially exposed to a patient with COVID.
Wow. Yeah, so in that regard, then it sounds like the healthcare, obviously, given the nature of population conditions and things like that, saw these numbers are largely representative of that particular area, right?
Right. I think most of these numbers you would see, and I bet you if I pulled these death claims out a little bit closer, most of them would be in the healthcare field, where they were getting not just passing exposure or filtered exposure, they were getting direct exposure where they were working in that ward. Yeah.
Okay, and so Felicia, I know, as Rob has already said, is that, we all know the schools closed down on March 16th. And so your worlds look very different. Would you agree?
Yes, we're a little bit of a tale of two cities, Rob and I ran some numbers for this program so I could sort of illustrate what happened. The work comp program that I manage has over 50 member school districts and charter schools in San Diego and Imperial County, with about 40,000 covered lives. That's the size of our program. When you look at the CWCI chart and the information that you can see here on the COVID claims for the accident year 2020, you can see the COVID claims rose to 103,712 in California. And per the CWCI, more than 1 out of every 6 work comp claims was a COVID-19 claim in the 2020 accident year, which is really significant. And that's statewide, right, for the program. When I took a look how our program was impacted, the predominant amount of our 40,000 covered lives were working at home after the shutdown of our schools on March 16th. We did have some essential workers on site, mostly custodial, food service, as I spoke about earlier, and some of our payroll and HR services that we're doing, banking and payroll that is essential that has to be done there. But the predominant amount of us went to teleworking and virtual platforms. And so we didn't have the amount of employees working on site teaching children in classrooms that we normally would. And so I looked at our new claims prior to COVID-19, and they typically ran about, we got about 1,600 new claims a year. That would be an average. And this past year with COVID, that was down to 600 claims. So that's a reduction of 1,000 new claims that we did not get, which is an over 60% reduction in claims. We pivoted our team as this was happening, our dedicated claims team at Athens, to concentrate on settling some of our older claims and complicated claims, so they could focus on that because there were so few new claims coming in. And then when SB 1159 passed and our school districts were tasked with the responsibility to report all positive COVID-19 tests into, and Athens pivoted really quickly and created a portal for us in 5 days so that we could get that information, because we had to, as Rob said, retroactively report all of our positive COVID, and we had hundreds of them, right? So we've had 1,500 cases reported into that portal of positive COVID-19, but we've only had seven workers' comp COVID-19 claims filed, which is obviously a very low number. 4 of those, I took a look at those 7 claims in preparation for this webinar. 4 of those claims were denied, primarily because they either didn't test positive for COVID or they had a family member that was positive for COVID, and so that's where the transmission occurred, or they didn't work on campus the 14 days prior to COVID, and some employees didn't understand that is part of the law. And 3 of the claims were accepted, but we did not have any hospitalizations on our COVID claims. No one was in ICU, and we had no death claims. So obviously our numbers are vastly different from Athens' numbers as a whole. I will say that our total claim inventory went down also. We normally, the year prior, right before COVID happened in March, we had about 1,400 open claims, and I looked back 3 or 4 years, and that tracks with an average year. This year after COVID, we're down to 1,100 open claims. So our inventory of our open claims reduced 20%. And we did have sort of the negative impact that COVID had really with our existing claims was access to medical care, access to medical appointments, access to diagnostics, access to procedures. Surgeries were being canceled, delayed, moved, rescheduled. And then what happened at the board, depositions were getting delayed and rescheduled. Nobody wanted to meet to do a deposition. So we pivoted to virtual for those. We pivoted to a virtual world for the WCAB for hearings. And we did figure it out, but it did cause a delay in getting that technology caught up and being able to do that efficiently. And now obviously we do all those things virtually. So that we thought we never could, obviously we could, and we have been doing them, so.
Yeah, who would have thought that we would have transitioned so quickly and effectively and efficiently in just a short period of time? I know I've heard it said in other avenues that what we've accomplished in this last year, we probably wouldn't have been there for another 10 years, because we get used to doing what we're doing. And so sometimes it's hard to change, but we were all forced to change in ways we never imagined. And so, yeah, there's a very different world depending upon, where you're working and what's going on. And so, when we talk about that, then, I think it's time we talk about the impact and return to work practices then. And I believe both of you can then talk about, this notion of essential workers and what did that look like in your respective areas of the industries?
Well, so we've had the essential workers being police, fire, and healthcare back in the workforce for a long time. And I think now you're seeing, just high vaccination rates in those populations. You're seeing people returning with masks and distancing, and we're seeing a lot more spacing out, talking more about hotel, sort of cubicles So where you come in and you just dock your station there. But then, like a hospital can't really do that. So really it's about separating who's being exposed. So these are the people working in COVID ward. These are the people who are not. And then also we have a lot of return to work jobs right now that are temperature screeners, mask enforcers. But these will gradually fall off, and then we'll have to find new return to work options for some of these people.
So you were basically able to reallocate resources internally to perform other new tasks now required as a result of COVID.
Exactly. The FDA required, or CDC required certain, like contact tracing, some temperature screeners, stuff like that. And eventually, I hope, those people, those tasks will go away and the people will be able to stay into other roles.
And Felicia, how did that look for the schools then? I know we just had a question the other day from one of our participants on another program as far as, well, who's essential and who's not these days in the school environment?
That was identified. I remember so vividly going to the county office for a meeting for all managers, and we were all called in the day before we were going home and shutting down. And I remember they said, you're all going to have to take a look at your workforce and determine who's essential, who needs to be in the office, because everybody else is going to be teleworking if they're not essential. And so each district sort of did that analysis for themselves. With the shutdown of our member schools due to COVID, the ability to provide temporary accommodated duty and permanent accommodated duty was really limited for a lot of our member school districts. And this made accommodations more challenging even than they already were. And due to COVID, we've received, ever since March, many requests for accommodations with regards, and because you're involved in a lot of them, regards to return to work on campus for a variety of issues due to health conditions of the employee, concerns about childcare, their children not being in school and not wanting to leave them home while they're doing remote school, fear of infection on campus, family health issues, and then issues surrounding the vaccination. Many of our school districts obviously are encouraging vaccination, but have voluntary policies. We have a few that are mandating or that have bargained vaccination, but not the majority.
Yeah,
and so, go ahead.
Yeah, and we're seeing a lot of that, or we're seeing more of the anxiety to return to work playing a large part in being what seems to be symptomatic of maybe either, post-COVID or post-vaccine symptoms or reactions, like increased heart rate. And so now you have to try to figure out, is the heart rate being increased because they're being asked to return to work, or is it because of the reaction to, either post-COVID or the vaccine that they just got or are afraid to get even?
Well, I know from my perspective, been working with a number of different employers, particularly in the school districts and then cities, is that we've always had a certain level of anxiety and depression out there, but now the numbers are reading around 40 to 50% of people are reporting anxiety and depression, and so there is a lot of angst about going back onto the job site. And I know one of the things that we've been doing more recently is approaching things from a transitional perspective, giving them a chance to, really going over what kind of protocols have been put into place in terms of, social distancing, is there on-site testing and things like that. I'd like you both to talk more about what are your respective employers doing for testing even today, but then also allowing them to come on, making sure that they're involved, making sure that they're involved with EAP, Employee Assistance Program, so that they're getting support and guidance there, and then phasing people back in over time. And so, one day a week or half a day, and then another day the next week. And so they slowly build up, and they can sort of manage their anxiety in that regard. And that's turning out to be a very successful approach. And one of the things that, from an EEOC perspective, is that, you know, if there's a time for flexibility and creativity, this is the time. In terms of addressing each and every unique individual concern, and trying to, you know, again, the ADA is about being at work, staying at work, and performing the work. So how do we help people get back to work? And what I found interesting too is that it's really challenging when somebody actually has an underlying condition that doesn't allow them to take the vaccine. I've even had a couple of people who have conditions where they react to some of the agents in the vaccine. So that makes it even more difficult. Yeah. But what's happening in the world of testing these days? I know we've come a long way, baby, since vaccinations were released, but what's still happening from the testing perspective?
Well, so the county office, because of the some of the things the governor put in place, we've had mandatory COVID testing for all employees. We're tested every other month. Even if you are fully vaccinated, you are still in the mandatory testing program. And then obviously we have a robust contact tracing and notifications as required per AB 685 letters that go out to any employees that may have been exposed to an individual with COVID, with quarantining due to that. So I have to give a shout out. I didn't mention with the 7 workers' comp claims in our over 50 school districts and charter schools, that speaks volumes to how well they did with their safety measures, with their protocols, with taking people's temperatures, with spreading apart, with the cleaning that our custodians did. That is in large measure speaks to the success of all of our staff with following the science and the CDC and the local San Diego Health Department guidelines. So shout out to my school districts. I did want to say that as more of our school districts, a lot of them have been open in a hybrid schedule for a while, but more and more of them are opening now 4 days a week, 3 days a week, 5 days a week on varying schedules. And as they reopen, we have seen a trend that we've been receiving more requests from employees who do want to continue working from home and continue teaching in a virtual setting. And that actually has been possible in some instances because not all parents want their some parents are keeping their kids on the virtual system through the rest of the school year. And so not all the children are returning that were on campus before. And so that's helped with the spreading out, and that has helped with some virtual teaching positions. And I know you and I have worked through some situations where teleworking can be an accommodation, a reassignment can be an accommodation, demotion in some instances can be a reasonable accommodation. So you have to be creative and think wide on what you can do rather than narrow.
Yes, and that's a really good point. I think that, again, a couple of things that I've seen is that, recognizing that, things continue to improve through this pandemic is, again, going back to what I said about being flexible and creative under the EEOC guidance, is that to take a look at what can be done on a short-term basis, in particular for schools, because schools will be letting out again come June, and then to know that we may reevaluate possibilities come fall when hopefully the pandemic is even under better control, and et cetera. And so, really what can be done short term, what can be done longer term, and for right now, making agreements about short-term accommodations because things are changing so fast and furious, and guidances continue to come up. Yeah. So Rob, I'm curious, because you do work with some self-insured large entities, what's happening more in the private sector? Because I'm real familiar with the public sector, with schools and cities, but what are we seeing out there in the private sector?
The private sector is a lot of, like our office, we were able to, as soon as the shutdown happened, we were able to, we like to use that word pivot, but we were able to scramble and grab our devices and go home, right? Like that day it was call from the president of our company saying, go home, grab your computer, take whatever you can grab and go home. It was like, Yeah, it almost seemed fake, like somebody was pranking us, right? So, and I think a lot of companies did that, where grab your device, grab your computer, grab a docking station, your monitors, whatever you need to make yourself comfortable at home and be able to work, grab it. And then our IT departments, and we're seeing these in multiple companies, even with the school districts too, they are the unsung heroes, because they were able to, in a matter of 24 hours, do what they couldn't get done in 10 years, right? Like, they were able to make us virtual in a way that functioned in a, in a pretty seamless way. So, a lot of clients, were like, "Oh, you're working from home now?" And it was like, "Yep, I'm working from home now."
Yeah.
So, but I think we're seeing that a lot in the private sector, and so they were able to avoid more of the interpersonal contact that has to be there to spread. And then we're seeing a lot of, once it's in your house, COVID is in your house, it's a wildfire. There's hardly a way to get away from it.
Mhm.
And even, I don't even believe the negative test. When somebody in the household tests negative and they all test positive, you're like, that's a false negative. So you better just quarantine yourself, right? So.
Right, right. Well, I know one of the challenges that again, being flexible, creative, allowing telehealth or telework to continue on, is that the lack of a socialization, which then feeds into anxiety and depression. And so I know in my research, in terms of where is the future going, and we'll talk more about that, but it does get into this tiered approach too, as far as realizing a lot of work can be done from telework again, and still having their brick and mortar, shall we say, but allowing people to work, continue working from home, but then creating events for people to come in so they have that social contact and that engagement with each other, because otherwise it's like out of sight, out of mind. I know for the schools, it's concern about teachers continuing to teach from home, then they don't have access to all the technology that is otherwise available to them in the classroom. And so a lot of teachers are on site, but students are still remote. And so they still have access to their colleagues and access to their technology.
Yep. Then you all, at being at home also, brings up a whole slew of other types of workers' comp injuries. Like we, have a bunch of ergonomic issues. We have people who are tripping on their bath mats, and getting injured, and you open yourself up to a huge amount of liability. So it's the future, and we just need to learn how to deal with those claims.
And I don't know about you, Rob, but I've been so surprised. I thought we would get a lot more claims from ergonomic type issues and just from slipping and falling on the way to the refrigerator, right? From the home office. But and we have had some. I don't want to say we haven't, but I can count them on two hands. I mean, it's been minimal. It hasn't been this explosion of at-home injuries that I thought we might see. So
I thought we'd see more. Yeah.
Well, I think that's one thing that we saw happen very quickly with the schools, and now I've done it for others too, is doing virtual ergonomic evaluations. And so it's shifted my whole approach to it, but it's actually worked very effectively by doing some education up front, giving them some materials so they can sort of evaluate themselves what's not set up well, so that by the time I do have a virtual meeting, then they're much more informed and ready to go than it was ever on site. So a lot of good things that have actually happened. I'm curious because the guidance about vaccinations, and Felicia, you touched on this earlier, but both of you actually, where do you see your respective industries on vaccination? I know EEOC has said that you can mandate vaccination, but let's talk a little bit more about that. When can you and when can't you?
So because the EEOC made COVID-19 a direct threat, so because of that, you're right, they have put out guidance that you can, in their guidance that they put out in December of 2020, that you can mandate vaccinations. I will say throughout our member school districts and charter schools, very few of them are doing that. Most of them are encouraging. We even set up a website to help everybody get vaccinated and have access to the vaccine, to encourage as many to be fully vaccinated as possible. But it is mostly a voluntary policy. There have been some districts that have been bargaining it or mandating it, but I will say it's the minority, not the majority.
Okay.
I've seen that too with the hospitals and the nursing homes. Um, they're not they're encouraging it. They're making it easy to get access to, but they haven't as so far as mandated it yet. And I think that is it could be a legal pitfall where you mandate the vaccine and that liability you incur for whatever like symptoms or reactions they have. And so right now they're encouraging it and taking on that liability, and they're comfortable with that. But they're strongly encouraging it because they want to see what's best for their employees, and they want the employees to be comfortable returning to work. So at some point it's going to be if half of them have it and half of them don't, but you don't know which are which, then is that still a comfort level that your employees are going to enjoy being in that office? So and so I have to think about that even in my own little office. What feelings does that raise up in me being around people who are unvaccinated, or being around people who may have a different philosophy on the vaccine than I do? So yeah.
Yeah, and so I believe if somebody declines to get a vaccination and then gets COVID on the job, then that becomes a COVID on the job condition, or what?
Yes, I have had several of my school districts, and Rob can chime in, but for some reason they thought that, Deborah, they thought that if the employees decided voluntarily not to be vaccinated and then later got COVID, and that they would be precluded from filing a work comp claim, but that is not so, correct, Rob? And so I was surprised that they thought that, but that is what they thought, that it would be a bar to benefits, but it is not.
There's some labor code that's never been used, or that I've always wanted to use, that would bar benefits from people who refuse treatment, but it's reasonable treatment. So you have to then define what's reasonable for each person, right? So is a vaccine reasonable for that person, and did they refuse reasonable treatment? It's just a whole can of worms, and I think we'll see case law on this, but we
sounds like a loser to me at the board, but just my opinion.
That's not case law I want to make, right? Like
right. We won't be making that case law.
Well, I think that ties into, because I mean we've been challenged in so many ways this last year, not just with the pandemic, but of course the social unrest and the political upheaval. But that's one of the things that in this new to vaccine or not, there is a lot of attitude and bias. Unfortunately, that's happening out there, and towards one another, as far as why aren't you getting vaccinated, and well, I don't believe in it, and then being in close proximity, and then with all the variants. And so you mentioned Dr. LaPalooza, Felicia, and actually shortly after the pandemic hit, he was on my podcast. And I really, this has stuck with me, and I use it a lot and give him credit for it. But as a psychologist and working with a lot of work-related conditions, that he said, people just really want to, as it says here, hear me, protect me, support me, care for me, honor me, and so people have greater needs in terms of being, all of these things. And so I was reminded of this little picture on the upper left of our screen here, and that, it's really, backing each other up. And if anything, again, having that more creative, flexible, compassionate, care and concern for one another, because there's not anybody in the entire world that hasn't been impacted in some form or fashion, right?
Yes.
Yeah.
Are you seeing any increased use of your employee assistance programs as a result?
We have been seeing increased use both in adolescents and adults in our mental health counseling, because we pay for that through our work comp program, and I manage that program as well. And we have we've also seen family members, because we extend it to family and anyone living in the home, accessing that because of some of the economic and mental health stressors that COVID has caused on even not only just our employees, but the family members of our employees.
Okay. And Rob, any trends in your arena?
You know what? I don't actually get to monitor that program, but I would agree with Felicia. If I was to, be able to listen to those calls, or that be able to access that, I'm certain I would see that, because even in just supervising, you get a lot of, contact from your teammates, contact from your, from whomever, and you get a lot of just stories of how COVID has impacted them. And so you end up, like you said, it's about responding to the needs of those people, whether you're doing it because you want to see the best outcome for them, or you're doing it because you have a heart for them, like I do. You just want to make sure that the best is there. So
Yeah, we all have stuff going on. Felicia, I did want to have you touch quickly on what's happening with new hires and drug testing, what you're finding there.
So it's been interesting because we have been doing a lot of hiring, obviously, because of the opening up more and more of our schools in a hybrid, and some going to 5 days a week. We've been adding positions so that we can spread everybody out. And we have been seeing an increase in positive drug testing results for not only THC, but also opioids and cocaine. So that's been sort of interesting, but that tracks with what you said earlier about a little bit of a rise in use of alcohol and drugs. So we're seeing it showing up because we tell you that we're going to drug test you. Not all of our school district drug test all their employees, but the majority of them do. And you know that you're going to be drug tested before you go. So it has surprised me.
Yeah. Well, and that's where we've seen a huge shift in the mental health field too. Is there are far more online services and telehealth sessions available before, and insurances are covering it in a way they wouldn't have, or paid less for it in the past. And so that's another trend that's changed. I do want to just point out before we move on to our next slide that and this is definitely an area as we move on, more and more people are back to work, and yet we still have this hesitancy for a variety of factors. That's where again, it has to be taken a look at on a case-by-case basis, just like the ADA has always required, and even more so. This is where the interactive process can really be your friend as far as uncovering it, and again developing that plan of action of a transition. Again, what will help you get back to work, and does it fit the business need to continue working from home? And as we know, a lot of jobs can be performed effectively from home, and yet that's where we're seeing more and more of this trend towards hybrid happening. And so want to talk a little bit about the importance of these long-term effects, or the long haul, as we said. And so I just mentioned a little bit about the EEOC and ADA, but Rob, I know that you've had a lot to say as far as some of the long haul effects that you've been seeing in your arena.
yeah, so you have these post-COVID symptoms, the long haulers. They're called a variety of different things. Once we pin down an acronym, like workers' comp loves to do, we'll broadcast that widely, right? We'll start all using it. But we are seeing a lot of people who are having, like I said before, it seems like anxiety-like symptoms where they're having, lack of oxygen, some neuropathy in the lower extremities due to this prolonged lack of oxygen. And they're having to do breathing exercises, physical therapy, different medications, like their hypertension has flared up or something, So you're seeing a lot of these type of treatments, but I don't think the treatments seem to be more geared at the symptoms, and I think we'll see over the years, maybe if it does, hopefully it doesn't take that long. Maybe over the period of time, we'll see more studies into instead of just giving anti-inflammatories, we need to give antiviral agents. We need to give, sort of focus on the virus more than the symptoms. But it's really tough to see these people, out of the quarantine and not be able to return back to work because they just can't sustain the work they were doing before.
Yeah, yeah. Well, on that note, then, some comments from both of you then as we wrap up our program today. But where do you see the future going from your respective industries along these 4 topics here: telehealth, telework, vaccinations, claims management, particularly on the claims management piece of it, because we've touched on the others already.
So I was really happy that I added telehealth through Concentra in 2018 to my San Diego JPA MPN, but my injured employees were slow to adopt. They didn't use it, they didn't like it, they really went to brick and mortar, our brick and mortar clinics. But then COVID happened and telehealth was a necessity, and now they love it. And it went crazy, and they love it. They love it for follow-up appointments. They love it for tele-rehab. It doesn't work as well as some in-person PT, but they've been using it. And it really works in the telecounseling, telehealth in the counseling world. Our dedicated claims team, shout out to all our folks at Athens. They have been working from home since March 19th, and they have been, if anything, even more responsive and better customer service than we were it was excellent before. And we're doing everything virtual now. Our Teams meetings, our trainings, and our file reviews are all done virtually. And some of that probably will continue even after COVID. And our claims team loves working at home. I'll let Rob speak to that. And from a client, we've had no issues. I've had no complaints from my school districts, and they've been working just like they did when they worked at the office. So if that continues, we have no issues with that either. And I have to say, from our own office, from the JPA's perspective, we have streamlined so many of our procedures, from Adobe Pro signatures in the digital world to Microsoft Teams for our Zoom, for our chats, and all of our processes have been streamlined. But some of us have found these things are more efficient, so we're not going to go back to the old ways. We did a lot of paper before, and so a lot of these new processes are more efficient, so they're going to stay even after COVID.
Yeah, I think, yeah, she's absolutely right. And I think, like for Athens as well, we have a claims management side of things. We've developed an app, and I know we've rolled it out to the employers, and they can kind of check their, progress for their files on an app on their phone now, with very stringent limitations and security. Don't worry about it. And then the employees, we also just rolled out an app for the employees to contact their claims examiners, because this new world we're dealing with is going to have to advance as well. And like Felicia said, virtual meetings, virtual claim reviews have all been going really well. We've all gotten used to Zoom and other platforms. And then one last thing, the electronic filing with the WCAB, that's something that's being instituted, and I'm spearheading for my team to make sure that this paperless world continues in some ways, and we reap the benefits, not the downside. So.
Well, I'll just add it. There was a time, Felicia, where we never thought we could do an interactive process meeting by virtual, right? And we found that actually across the entire dispute resolution field, it's been very successful to go online. And I know people, complain about the technology parts of it, but I don't know about you. I'd rather be here with a few glitches on vocal and audio than I would be stuck on the 405 or the 15. So I'll take this any day. Thank you.
Well, we do have a question. I see it's time for questions and answers. We have one question from Kathy, and she says that you stated that there was mandatory testing at 30 days. Is that a CDC requirement or protocol, or is that just something that your district's doing?
It's for schools specifically. It's from Governor Newsom, but it was specifically for our schools.
All right.
Healthcare and it has their own guidelines. It could be weekly,
everybody's
on their contact. It could be bi-weekly, depending on like their living facilities and stuff like that.
Very good. Well, we don't have any other questions, but I do want to thank you all so much for your expertise in sharing this information. This was an outstanding presentation to be able to have a look back on what's actually happening in claims and what is happening in our industry. So thank you so very much for sharing that, because you also introduced the mental portion of this and how that is really important to take care of people. Thank you, Rob, so much for having a heart for this. I think that's really what our injured workers needs, is someone like you that's so compassionate and feels it from the heart. So I just wanted, in closing, remind you of a few things. Your certificate will be emailed to you within the next couple hours. I did say that this presentation will be available on the MacroPro website. That was a mistake. It will be available on the MacroPro YouTube page. So please be sure to look at that if you'd like to see an encore performance. And then lastly, we have 3 MacroPro and Friends webinars coming up next month. There'll be one on the 6th, the 11th, and again on the 26th. So I certainly hope that you can join us for those. Until next time, we thank you all. And I would like to say one last thing. I did see a few people ask about handouts. They are attached to this. If you click the handout button, they'll say 5 out of 5, and you can download them. If you have any problems with that at all, please just email me and I'll be glad to make sure that you get a copy of that. And that's DIANN@macropro.com. Until next time, I thank you all experts and I thank you all attendees for joining us. Bye-bye now.
Thank you, Diane.
Bye-bye. Are we getting off, I guess?